Welcome, Michelle Routhenstein, to the Dish with Dina podcast. Thank you so much for being with me today.
Thank you for having me. I'm excited to be here.
I'm excited too because you are a registered dietitian like I am, but we've never met in person, real life, on the virtual space, I think, until just recently. So I'm glad to have crossed paths with you, and I'm so grateful that you accepted my invitation to come on here and talk a little bit more about yourself. Which brings me to my first question. Can you share with us a little bit of a snippet of who you are currently right now, where you're at, what you're doing, and then, of course, we'll dive into the details of our conversation as we progress.
Yeah, happy to. So my name is Michelle Routhenstein. I'm a cardiovascular dietitian, which means that I help individuals optimize their cardiovascular health at any stage in which they are. So I see a lot of people who are in primary prevention. So they have a lot of risk factors for a heart attack and stroke, whether that's high blood pressure, metabolic syndrome, insulin resistance. And also I see people who have cardiac diseases. So atrial fibrillation or cardiomyopathies, heart failure, that whole realm of things. And then I also see people in secondary prevention. And secondary prevention kind of has a big, broad kind of outlook, whether that's, okay, someone had a cardiovascular event, they've had a stroke, they've had a heart attack, they've had an aortic root dilation, aortic root aneurysm, but it can also be someone who has high calcium score that now they have coronary artery disease, and that sometimes people look at that as primary because they didn't have an event. Others may look at it as secondary because they've had that heart and plaque progression as well. So I'm all about the heart. I've been doing this for over 14 years, and I love specializing in cardiovascular disease because I get into the nuance of what happens in the blood vessel and how we can optimize that through science-based nutrition. And the power of nutrition is just so lovely in optimizing so many things that improve heart health, which then improves quality of life and longevity.
Amen to all of that, my colleague. And I want to find out because I love an origin story. We were just talking about your start in dietetics. I'm a second career dietitian, but you are not. So share with us a little bit about how you even found your way, your path to this profession.
Yeah, so I mean, my dad has an infamous quote since I was younger that I never truly understood until I got older. And it was, if you don't have your health, you have nothing. That's always what he said to me. And so we always had a big emphasis on preventative medicine, nutrition in my household, but it was never really looked at that way. It was just kind of the way I was brought up. And so I always felt, okay, well, I love medicine. I was an EMT. I did all of these things in my high school years. I was like, I'm going to be a physician. I want to be a doctor. So I went to NYU in the pre-med track, which does not have a major. You can't major in pre-med. So I was like, well, that's what I want to do. I don't know what I want to major in. So I decided to major in nutrition, clinical nutrition, with a minor in psychology because I figured, well, that makes sense from a doctor's standpoint. But then when I was in my training, I realized that it actually is very segregated in the American US culture in terms of medicine and nutrition are not looked at the same. Doctors don't get any nutrition education, but then the field of nutrition does. And so my dad's very practical. He goes, Michelle, you can't be working your butt off to do medicine and nutrition. There are two different clinical residencies. Like you have to choose one. Okay, so I decided to go into a hospital environment and I wanted to look at the dietitian. So I followed a dietitian who was looking over the ICU unit. And one story really struck me and changed the trajectory of my career. And that was I saw a 35-year-old man who was getting a bilateral amputation. I had a conversation because I wanted to see what was going on. And I was just said to him, I was like, oh, how's your nutrition? Have you ever seen a dietitian? He's like, no, the doctor just told me to take medicine. What do you mean nutrition? And that hit home because I'm in the preventative mindset. I want to help this guy prevent those complications. And so I decided to spend my career in to go into my clinical residency as a dietitian, get my master's degree at NYU for my dietetic residency. And then as I was doing all of that, you finish your RD and you're a generalist, a little bit about everything, right? You're like a general practitioner. And there's no, at that time, 14 years ago, 15 years ago, when I was in my training, 16 years ago, there was no like, hey, let's specialize in anything. It's like you're a generalist, you could see everything. But as I was going through my clinical residency in the cardiovascular step down unit, in the kidney clinic, in the liver clinic, in the heart health clinic, in every single subcategory of a disease state, everyone was having heart disease. Everyone had heart disease related complications. And if you look at the statistics, every clinic, heart disease is the number one killer globally, over all cancers combined, over everything that you look at. The thing that kills these individuals in every subgroup is heart disease. But then my preventative hack goes on and goes, but 80 to 90% of heart disease is preventable. Ooh, what's going on here? I don't like this. So I started doing a poll. I spoke to the doctors in the hospital. I'm like, why is this? It doesn't make sense. And everyone said they're non-compliant. And I go, and I don't like that answer because no one wants to not live a long and healthy life and have their health. So I did not accept that. So that's when my journey began. Right after I graduated from my clinical residency, sat for my board exam. I ended up actually creating a cardiology fellowship in Manhattan for myself. So what I did was I actually worked alongside the varying scopes of cardiology specialists. So I work with internal cardiologists, like just general cardiologists, internal medicine doctors who specialize in cardiology, lipidologists, preventative cardiologists, electrophysiologists, heart failure therapists, like every single type of heart related condition. I was the dietitian there. And I was talking with them, and they have a very, medicine approach, medicine approach, medicine approach. But if you actually really hone into every detail of every single medication, they're all derived by pathways in the body that require nutrients to work optimally. So I would go to conferences. People are like, why are you here? It's a drug conference. I'm like, because there's a nutrition arm that no one's listening to. So I created that, and I worked alongside a lot of top cardiologists within Manhattan for the beginning of my career. And then from there, I've always had a private practice, but only did I go in private practice when my second son was born, because I was like, I can't be commuting. I can't be doing that. I want to be present as a present mom for my boys. And so I started my cardiology. I really pushed in that at that time period, and I've been doing that for a while. And so a big part of it, and so when I was doing that, I was primarily in Manhattan. I only saw people in person in my office. I was getting referrals from cardiologists, and my clients were referring people to me and all of that. Then COVID hit, and a lot of my cardiologists actually moved out of Manhattan. They either retired, they did telemedicine, they did other things. And so that was when I started my online presence. And what I noticed is that most people have no idea that they are at risk for heart disease. And most people are very reactive. They go, oh, okay, I had a heart attack. Now I have to do something. Versus, I have high blood pressure. I have high cholesterol. I have diabetes. Oh, I should be doing something now. And so I created this arm of awareness, and I really try to push it. I can't change everyone. I've gone to so many events where people are like, oh, I don't have any issues. And then they're on a laundry list of heart disease and cardiometabolic drugs, and they don't want to address their nutrition. But my big message is you can do so much with nutrition. You can get off medications with nutrition. You can reverse plaque progression with nutrition. But the research really shows that these things only really happen when you pair it with a registered dietitian who is really helping honing into the details. Because most people misinterpret the Mediterranean diet, the DASH diet, all of these diets. They pick and choose. They don't understand nutrient adequacy and pairings and all the things that are required for optimal heart health and vascular health. And so I see the power of so many amazing stories. I fall off my chair all the time with stories, but I see the power of nutrition, and it drives my passion. So yeah, I started off really early, kind of knowing what I wanted to do to help people, but I had to kind of get into the exact component through kind of a zigzagged pathway, so to speak.
I feel like I was on a roller coaster ride of a lot of the things that you were saying. And as I tend to do for those of you watching, and for Michelle, since we've just met, I'm scribbling my notes as I always have here. I have 1,000 follow-up questions, so I'll do them in no particular order. The first thing is coming from the healthcare provider standpoint, understanding that there's only, it feels like a very small percentage of those of us in the dietetics profession. I think at the time of this recording, it's about 112,000 or something of us across the country versus the millions of doctors, medical doctors, other specialists, and nurse practitioners, nurses, et cetera, that are in those more clinical settings. And I know that we love being part of an interdisciplinary team. What was it that you felt really enabled you to connect with people that allow them to include you in that discussion as a valuable advocate, and not so much about, a lot of times we're hearing, especially nowadays too, of placing more emphasis on extra training or extra education on other healthcare providers versus just using the people who are already trained in that. So how did you allow yourself to establish those relationships? And I ask this also keeping some of the students and interns in mind too, of when they're navigating the internship, of kind of like being aware of the language that is using, and building those connections too. So I'd love for you to speak more about that.
I would say a lot of it, like any relationship, is built off of trust. There's a lot of mistrust in the wellness world, particularly. And I've worked with a lipidologist who looked me straight in the eye and said, Michelle, as much as a diet can improve the quality of life and help people, it can kill them. This is a lipidologist. When people have metabolic lipid disorders and a wellness influencer or a nutritionist who has no idea about the actual medical nutrition therapy, they can harm them. And he has told me so many stories. And the big part is the first client that someone gives me, the first person that we see, and this is also starting from the hospital. I've built rapport with the doctor by showing the power of nutrition. And that one client that then sees that the doctor sees the success and goes, I've never seen this before. He starts sending me all of them because you're like, this is the woman who's going to help you. But I think we're in a very crazy world where there's so much misinformation that the doctor needs to trust you as well. And so that comes into play of having open discussions, talking and asking wise questions that go with it, and also catching mistakes and calling them out. I think I've built a lot of good relationships because people are like, no one has ever said I was wrong. And wow, you are right. And I was wrong. And I'm like, thank you. It's not going to work with every single physician or healthcare professional. Some people may not like that, but I'm the kind of person, I don't say it in a rude way, but I've seen sometimes where they've ordered two medications that contradict each other. I've seen times where, their labs are really saying you should not be on this medication. And so I'll go and say, oh, I noticed this, should we change this? They're like, oh, wow, thanks for catching that. Right. And it's also showing up to meetings and being and saying something that's beyond a simple eat more vegetables. That's not what, like, I have so much nuance. I have a cardiologist who calls me every week and he goes, Michelle, what's new in nutrition? I always learn something from you. I always am like, this is what should happen because he trusts me. He doesn't know that knowledge. I have cardiologists who are my clients. Okay, so we have to understand that we are an integral component of our field, and dietitians must be sitting at every single table of discussion because if it's not, the quality of a patient's life is going to be declined. It's simple as that. Because even if you have familiar hypercholesterolemia, you have FH, your body doesn't know how to process LDL cholesterol. If you ignore your diet, you will have to go on high dose of every single medication and still it may not be at target because even with medication that's necessary from a genetic standpoint, nutrition must be paired with that. A lot of people are like, oh, well, my labs are fine because I'm on a statin, I'm on a blood pressure medication, I'm on all these things. And they still have heart attacks because you're not addressing vascular health, the inflammatory pathways, and the things that need to be addressed. We have to show up at the table and we have to say what we've learned, apply it. Say something that someone goes, wow, she knows her stuff. I didn't know that. Because then they're going to come to you for every question. They're going to come to you. I have doctors who come and go, Michelle, what's your opinion on this? They look at me as a peer because I'm showing value to them and their clients. And so you have to show up and you have to show how we are not just a nutritionist who took a 1 month course and is following the trends and giving all these supplements. We have background that really makes us higher. And it's funny because where my parents are from, nutrition actually, the people who get an RD are called doctors of nutrition.
Wait, where is that in the world?
This was in Persia, so it was a
Oh,
while
okay.
ago and things like
Okay.
that. But it's
Right.
important to really recognize that.
Yeah, the value of what we do. And I love all of the things that you're saying because number one, it helps validate me too, like the approach that I want to take and I want to educate both on the peer-to-peer level and also the patient level too, of saying, and I've shared plenty of times on this podcast, I also help caregive slightly for my mom and I go to her doctor's appointments. Not a single time, Michelle, not a single time has she been referred to a dietitian. And that woman's walking around with hypertension for many decades. And then she ended up with chronic kidney disease, stage 3/4, by the time they found out that that was a concern. And even then, not once has she been referred to a dietitian. So that's really the thing that I want people to take from this too, is you're allowed to ask questions at a doctor, right? You're also peer to peer too. You're allowed to be curious as to why is this person on those particular medicines, or from what I remember, this might interact. Did you check those other labs? And, kind of that's the confidence I think that ends up happening within us too, as we get more comfortable in what we're doing. And especially with the professional development as well, of learning the what is new in nutrition. That's where we can come in and make those statements. I want to, if it's okay with you, I want to talk about the compliance discussion, right? The stages of readiness, readiness to change, and being compliant, non-compliant, of putting that responsibility on the patient, whether it is mindset, behavioral, or external factors that are beyond their control. How do you kind of navigate around that? How do you, number one, how do you address that conversation, or what are the steps you take to assess what is the barrier that is preventing this person from making those choices? And then what do you do to help support in the counseling kind of effect that we do under medical nutrition therapy, of meeting the patient where they're at and trying to get them back into prioritizing nutrition?
Yeah, I mean, I think most people who come to see me are in that ready to take action phase because it's not that someone is making them come. They're voluntarily coming to see me in my private practice. So it's different than, let's say, you're going into a hospital setting. But I think it's important from a healthcare professional to really understand where your client is and listen and respond. Because 9 out of 10 of my clients who come to see me come to me with a lot of health anxiety. And the health anxiety actually comes from not understanding their situation. It's, oh, wow, I have a high calcium score. Am I going to have a heart attack tomorrow? Oh my God, if I eat this, will I have a heart attack? If I walk, will I have a heart attack? It's a constant what if, what if, what if, what if, what if. And I go, wait, do you even understand your score? Do you understand your risk? Do you understand what an aortic root dilation is? Do you understand how we can prevent this because we're addressing the blood vessel and the havoc in the blood vessel that we need to improve from a cardiometabolic stand period? And many of my clients, and so a big part of it is hearing them out, meeting them where they are, and applying the strategies to allow for positive change. It's also important to mention that a lot of times the panic goes into, I have to change everything I'm doing. And when you do that, you put yourself up for, not successful results. My strategy is explaining the why, explaining, meeting them with their concerns, explaining their lab work, explaining their diagnoses, explaining all that, because the doctor doesn't have the time, unfortunately, in this broken healthcare system. So I spend the time. How does plaque form? It's not just you have high LDL plaque forms. That's not how it works. There's a multi-stage process. I explain that and I say we are going to address it at every stage of the way because that's how we reverse and stabilize plaque. And so explaining that, they're like, oh, wow, I can do that. I'm like, yes. We've seen it in a lot of our assessments of soft plaque. I've also had clients who had a heart attack. They got a stent. The doctor says, I have to do another stent, but you're too inflamed. Come back to me in 3 months. They work with me. They go back in. They're like, I don't need to do a stent anymore. Like, these things are really impressive, but people need to understand what you have power to do to change. So a lot of it is explaining that, meeting them with their anxiety, meeting them with their concerns, and then prioritizing on a high level 3 tangible goals. That way, if there's challenges, we address them. If there are things are going well, we add another goal and we continue to do that to make sure that we're seeing good progress. A big part of empowerment, a big part of change is also seeing first the feeling, right? So I have more energy. Oh, I sleep better. Oh, I walk better. I have more stamina. Seeing those imminent goals, but then also seeing those metrics. Because I have clients who are like, oh my God, Michelle, I did not know this is possible. What I'm doing works. I have to continue doing this. And that motivates them, right? My big thing is in the beginning, you need accountability, you need support, you need explanation, you need to know the why, you need to know what it needs for your body, all that personalization. But my philosophy, and I know a lot of dietitians don't believe in this, is I teach you so that you can do it, get the results, and then message me every year that everything looks amazing and you're doing well. My favorite emails are my 10-year clients who are like, Michelle, I don't know how to thank you enough. Can I take you out to dinner? Those are my favorite ones because things are going so well, they don't need me anymore. You really want it, right? So there's a shortage of RDs that have medical nutrition therapy knowledge. And even within that, how many of them are really niched down into specific disease states? I don't know if there's even that statistic. But if we're constantly seeing the same people and we're not teaching so that they can apply in every situation they're in, it's going to prevent our ability to impact more people.
I absolutely love everything that you're saying. And the thing that keeps coming up to me, which now you're making me kind of reframe how I'm viewing this for myself, is in the world of private practice, or even if not, even if you're plugged into a doctor's office and you're working out of there, when it comes to the insurance, when it comes to the kind of the overarching criteria that some people have to rely upon in order to even see us to begin with, that can then determine the amount of time that we spend with them. So like you were saying, you might be able to sit in a patient session for 90 minutes, but maybe only 3 times, depending on what that insurance does or does not limit. And so in my brain, the way that I'm thinking of this is kind of twofold. Number one, coming from it as the healthcare provider of how do I kind of get more bang for my buck in those patient sessions, taking advantage of whatever session time we have together. But as the patient, I'm going to use this term in two different ways, or as the patient who's coming to see me, how do I encourage them to be patient with themselves, of allowing them to gain the knowledge, implement it, especially if they can't come back and see me quite often. So, Michelle, I'm not sure in your private practice if you do or do not take insurance, if that plays into the role of what your answer is going to be, but how can the approach be there? Like, how can we help support people if they need a little bit more hand holding and if they need to implement some things that might feel a bit challenging to them to do on a regular basis, but we only have, 3 sessions with them, not unlimited time with them?
Yeah, so I don't accept insurance. So my answer may differ per person in terms of that, but I'll answer based off my experience in my practice. So I do programs with a lot of my clients. It's the most successful that they are, and it really helps them teach them and then kind of let them go. Or if they need more follow-up, we can do those as needed. But a big part of that is also I give them access to me so that they can ask me questions because a lot of things come up, product finds, restaurants, and like that's a really important support component. Not everyone can afford one-on-one services, which I understand. So I also do a group model. In my group model, I actually have a community forum where people put questions in there for those times of those groups. And then they also have like an extension program where you have access to me in your pocket as well. So that gives us lower price point, but still access to a dietitian because the beginning, especially if there needs to be a lot of change in knowledge, you do need a little bit more time. That's really how we see the most success. But once you understand the principles and you apply it, it really is something that holds you on for life. So I always look at it as an investment in your health. It's hard with insurance, and this is why I opted out of it. And this I know some people who do very successfully with insurance-based options is you have limited time, right? So there are times from what I have, you can correct me if I'm wrong, but like you have the CPT codes are for 15-minute increments. You have a certain amount of those. And for me, I can't really teach heart disease and when I'm confined in time because it's a complex, nuanced disease. And so the group programs allow a lot more of the education in the lectures for 6 weeks, in the live lectures that are also recorded. And then I also have many ways that they can ask me their questions and apply it, and I can give them feedback. So that's really a nice perk to that too.
That's wonderful because you're providing them with such a wide amount of information. And it sounds a little bit almost like self-navigating too. Like they have the library of whatever the materials that they need to review. You can be looped in that discussion as well, whether it is a live conversation or check-ins. Yeah, I appreciate that. And yeah, I'll confirm I do work with insurance. It is a little bit challenging. Sometimes we get unlimited visits and that's wonderful. And, 90-minute sessions and that's fantastic. But even then too, Michelle, what I find is people just, they can't take off an hour and a half every week to come see me. So sometimes we kind of like pick and choose what we're dripping out. And then there's the discussion around how they perceive what their priorities are of their goal setting too. So if they're struggling to keep up with something, not necessarily heart related stuff, but they're struggling to keep up with something, but they have in their mind, like, I want to, attend a wedding and I want the holidays to be a little bit more manageable for me this year. That can sometimes indicate the effort that they put in things. And I keep trying to scale back and say, it's a long-term journey. Like you're talking about not just today, but the person you're going to be 20 years from now, who that person is, not just the person who's getting ready for summer vacation or whatever the event is that you have in place. And I think people who are diagnosed with things, or I've noticed too, I've worked in prenatal counseling for many, many years as well. When there's other stuff involved, they tend to, get really nervous. Like you said, am I going to have a heart attack today? Or is my baby going to be affected by this? That kind of lights the fire. But I don't want that to be the case. I don't want you to have to be on the brink of a disease state. And I want to do what Michelle, you're kind of encouraging people, which I believe is from coming from it from the preventative approach, which sometimes it's a little bit easier said than done, understandably. So thank you for that insight. I actually want to ask you some things about business and running a practice and also doing all the things that are involved in maintaining professional development and taking care of a family as well. What is it that how do you structure your week? Can you give us a typical week in the life of you, whether it's doing blog posts or hiring virtual assistants? Like, how do you navigate all the things that you're juggling? And I keep in mind here some of our current interns who are going to be our future colleagues who might want to delve into private practice. What are some little gems that you might want to share of how do you do it all, Michelle?
So I think it's important, like I work with my clients, to do step by step. What are you prioritizing? Like I didn't do this overnight. It's not like I did everything overnight. I kind of looked at my priorities, and this is a passion of mine, right? I'm in here to really help people take care of their hearts so they can live long and healthy lives and prevent this preventable disease that's just so overwhelmingly global. And so my big thing is I'm passionate. So if you want to hear the back, I could tell you right now what happens, but I think for interns, it may be even helpful to see where it's coming from like almost day one. I mean, I was working in a hospital and I switched my hours to be 7:30 to 3:30. I would run to a private practice I worked for. I would see clients. This was before kids, all like until 9:30, 10 o'clock at night. People will be like, "You're crazy. Why are you doing all this?" And I'm like, because I really like it. And I really feel like I'm helping so many people. So, it was a hustle in the beginning to make things work. And then it was kind of a prioritizing. I had my first child. My husband was traveling all the time. I was very adamant about 7 p.m. bedtime so that I could see my nighttime, I would see my nighttime clients. And then I shifted to being in the beginning of the day. And so right now, I have four beautiful boys who are my world, and I work around that. So I put them on the camp bus right now, and then I get to work at 8:15. I'm working until 4:15. Go get them from the bus stop. Then I make dinner. We do bedtime. We do all those great things, and then I usually get back on for clients or other things at night. And it's a shift of many things, right? I told you I had a couple arms. So most of my day is filled with clients. I see a lot of one-on-one clients, and that's what I do in the beginning of the day and also in the evening. But I do a lot of also outreach with podcasts and with blog posts. I do a lot of media with journalists and things like that, just to get more people to become aware of their heart health and how nutrition plays a role. And I do attend conferences because they are important. And I usually attend conferences where there are many people in the room, because I think that's where we have the most impact as dietitians. So I go to cardiology conferences. I'm speaking at a big diabetes conference. I go into different places. I spoke at a college the other week. So I kind of do a bunch of different things, but it's all because I love it. You know, you have to find what you love to do and let that drive you to waking up every day and repeating and keeping that going. And you know, I also practice what I preach. So I'm I'm helping to my kids to be heart healthy and follow that and exercise and sleep and stress. And it's a lot, but again, it's prioritizing and it's about looking at what is one thing I'm going to do today. Okay, what's two things I'm going to do today? What's three? And you build that and they become part of your routine. And you kind of take your own way of counseling others to counsel yourself through that transition of building your business. And then, you know, every time I hear an amazing story or someone say, Michelle, you've changed my life, I I know it's worth it. You know, I know it's worth it. When people say to me, Michelle, you have given me my quality of life back because I'm no longer anxious. I have people who come to me on antidepressants, and when they finish with me, they're like, Michelle, I don't need it anymore. And I'm like, that's your decision. I'm so for antidepressants. They're like, Michelle, I was so depressed. They told me I was going to die. And if I don't do exactly what they say and take all these medications that made me feel like crap. And I'm like, we have to listen to our clients, just like you have to listen to yourself, right? If something doesn't serve me in my business, it's not for me. And you put that away. Your mindset is everything throughout this. And that goes to clients, that goes to dietitians too. What's serving you? What's making you wake up and go, yes, I feel fulfilled today? Go with that. You know, like I hear when people call me and they go, Michelle, my aortic root dilation shrunk, and my doctor said I would need surgery at this appointment, and I didn't need surgery. I was like, you need to scream that on the rooftops. I'm so excited. They are like, it is a big deal. And we have to celebrate the moments of how we help people because that keeps you going. Because in any business, there's going to be ups and downs, but you have to see, well, why am I doing this? Why am I in here? What am I providing value for? And let that drive you. So mindset is huge, especially in the beginning of any journey, whether it's your career, your health, or your health and your career journey. I mean, I have dietitians who are my clients and they go, I'm kind of embarrassed that I'm a dietitian and I can't help myself. I'm like, no need to be embarrassed. Like, I'm here to help guide you and teach you this because heart health is different. Not everyone knows that. It's the same thing. I wouldn't take someone who has a Crohn's attack and wants me to help them. I would refer them to a specialist in Crohn's. If someone wants to see me for an eating disorder, I don't specialize in that. I can't help that person. I want to send them somewhere else. I do discovery calls with every one of my one-on-one clients because I need to know I can help you. And if I can't, I will send you somewhere else because my passion and love for what I do comes from the success that I'm invested in my clients with. I want them to be successful. I want them to hear those results. That's what drives me to continue doing my work. So all to say, take a look at what are you in this for? What's your why? What's passionate? What's making you passionate about that? Same thing with clients. Like you said, okay, if they're not ready, what's their why? What are they here for, right? Like a big one is I want to be able to like watch my grandkids grow. And I'm like, yes, you should. Kids are an amazing blessing of life. And like, you know, it's as a mom, I'm like, I can't wait for my kids to have grandkids. I'm like, I'm gonna have grandkids. I'm like, Michelle, slow down, enjoy this moment. But I see that and I feel that when clients come and say that that's their why. So digging into that is big.
And I think this is such a wonderful thing that the behind the scenes of it all, that we're all humans, right? That's the common thread that even we're talking dietitian to dietitian, or you're speaking to an intern that might be thinking about their future career goals and what they want to do in their profession. But we're also looking at I want to share also this information because as a patient or a client standpoint, this is the effort that we put into our lives, our journey. And I think we've had discussions in some of the past episodes, Michelle, where we talk about the difference between a career and a job. Like, where does it start and where does it end? Once you start getting tired of something, you're just kind of like phoning it in. It doesn't bring you joy. And then other times you're brainstorming things while you're in the shower and you forgot to wash your hair because you got caught up in all of these thoughts. So I really love the human aspect of it all and also take into consideration anyone that does come to see us, they could be a variety of different people. They could be dealing with different experiences, different backgrounds, different risk factors, and also the colleague to colleague. Healers need healers, right? Dentists are going to dentists. Like, it's okay. You don't have to be embarrassed. There's no shame in the game to going to get some support in improving your health or at least helping you manage whatever it is that you need on your health journey. Michelle, what are some or what is a hot topic or current trend that you either are feeling very excited about wanting to share or maybe something that you want to clarify or dispel? And this could be something related to social media. It could be things that you've come across in some of your conferences or patient discussions.
The hot topic
Yeah.
that it keeps me awake at night because I'm upset about it because it's dangerous is the unethical publication of these group of people in the low carb community took the ketogenic diet, looked at people who had no insulin resistance, no metabolic syndrome, no high blood pressure, nothing else but high LDL and ApoB. And their theory and their want was you can have high LDL and ApoB, and if you don't have metabolic syndrome, you're not overweight, you're fit, doesn't matter. You can live with that because they're promoting the ketogenic diet, which can increase those values. Well, they published a paper that had a terrible headline, falsifying things. They left out their primary outcomes, and it just didn't make sense. It was very fishy. So other people were like, show us your data, show me your primary care outcomes, show me this, show me that. So they released it on social media, and then they actually showed the graph, and they miswrote it in the paper on purpose. The most unethical study I've ever seen. Do you understand what happened? I'll tell you. The ketogenic diet in 1 year in these people increased plaque progression the fastest we've ever seen in any research study. It went up 50% in dangerous soft plaque, not in the hardened stable plaque, in dangerous soft plaque. We never seen this fast progression ever in research. Okay. And these researchers decided to not share this information and still promote the ketogenic diet and says it does not cause plaque. This is dangerous and it's going to cause heart attacks in younger and younger individuals who are following the carnivore diet and the ketogenic diet. We cannot be ignoring the fact that LDL and ApoB cholesterol are needed to be deposited into the arterial wall in order for plaque to form. And at that high levels, they're diffusing into the arterial wall to cause issues. So there are many people, chiropractors, I don't even know why they're talking about heart disease, saying that cholesterol doesn't matter. We have so many studies that show a linear relationship with both LDL cholesterol and heart disease, major adverse cardiovascular events. And this makes me angry because my mission is to prevent this. I want to reduce the amount of heart disease in this world. And this is just making it worse. And on top of that, and I hate to like say anything bad about dietitians, but there are dietitians who are promoting the ketogenic diet. And I understand not everyone knows about heart disease, but the basics of medical nutrition therapy do show us that we know that this is not the right diet for individuals to prevent heart disease. Heart disease is not a hot topic right now. It is not sexy. It is not trendy. No one cares about I've had fitness people tell me that their personal trainers told them that blood pressure doesn't matter. Blood pressure doesn't matter. Hello. That causes everything from dementia, cognitive decline, kidney issues, liver issues, everything, heart disease, stroke, AFib. What? It's the misinformation makes me upset because it's so dishonest and quite dangerous. I hate to be so angry about this, but I
You
care.
should be. We should be. What I don't understand, a couple of things. I mean, this is what we call is like cherry picking data or biased research. Like, how did it even get past the peer-reviewed stages without anybody calling it out? And also, Michelle, what was the end goal? Was the end goal like weight management, which it tends to be a lot of times in some of these more restrictive, extreme diets, or what was
It,
the end goal of that?
it was to look to see if LDL and ApoB actually cause plaque in what they call lean body mass hyperabsorbers. So they said, oh, well, if you're lean, it doesn't cause plaque. That's what they were trying to show. And it was sponsored by a team of researchers who are in the low carb community. I don't know who they're sponsored by, but and there are people, I mean, I have clients who say to me, like, Michelle, everyone is saying cholesterol doesn't matter except for you. You're the only one I trust. And I'm like, well, thank you for trusting me because I actually care about you and I have no affiliations with anything telling me otherwise. I don't take those affiliations. Do you know how many times these like ketogenic beef supplements, the beef industry contact me being like, hey, can we like, pay you to say this and this? I'm like, no, you cannot. You cannot pay me to say anything I do not believe in.
No, exactly. I think, like you said before, with the trust factor in the consumer's end, right? The patient, the client's end too, of not knowing what to believe. They don't know how to read research. You're the one kind of looking at it and really speaking up towards it. And so that's doing a disservice to the health sciences profession, to anybody in the healthcare world. And also that's unfortunate, I think, because the people who are going to maybe be following somewhat blindly these approaches are going to end up suffering the consequences, like you said, and making their disease states even worse, or end up with a disease state that they didn't have to begin with. So that's very unfortunate. I appreciate you sharing that and being so candid about that too. Thank you. So, Michelle, what does the future you look like? Are there any big goals that you have as you are also kind of climbing your own ladder to success of however you're defining that these days?
I mean, I don't have like maybe a 5, 10 year vision plan. I kind of am more of the like in the now. And right now, in the now is serving my clients and really helping people with the knowledge because the misinformation online is very dangerous and people are so confused and it's taking a really big part of their quality of life. So my big goal is just to keep putting out my message of true science-based nutrition that comes with empowerment, comes with compassion, and comes with really helping people implement so they can live long and healthy lives.
What a wonderful mission. We should all be so fortunate to be able to work with you and work with each other. So I really appreciate that. Is there anything that we didn't discuss, anything that I didn't ask, any final words of wisdom that you'd like to share before I go into my last couple of questions?
I think it's a big part of empowerment. Whether you're any person, it has a risk of heart disease. Heart disease is the number 1 killer globally. Most people don't check themselves. So a lot of people, even in the healthcare profession, may be struggling with, let's say, weight. Maybe they're struggling with high blood pressure, cholesterol. Monitor your numbers, know your inflammation, know all the things, and then know what your target should be and work and achieve them through science-based nutrition. But a lot of times, you'll go to the doctor. Oh, it's high blood pressure. It's maybe white coat syndrome. Let's just monitor it. Let's just monitor it does not actually mean proactive action. It means just kind of waiting a whole year where damage could be done at very low levels to your endothelial lining and your blood vessel health and actually can cause plaque to progress too. So know your numbers, but then take action. And then once you've taken action, test your numbers again every 3 to 4 months until they're optimized. If what you're doing is not budging your numbers, you probably aren't doing what you need to do. So I would then consult with a specialist who can help you with those numbers and then retest it until they're optimal. Once someone's tests are optimal for 2 draws in about 3 to 4 6 month period, then you can maybe do 6 months or a year depending on your risk, but you don't feel heart disease. Heart disease silently brews until you will feel it in a very unpleasant way. You don't want that. Please take action and really look at yourself. So this goes to everyone, right? Even dietitians can have these issues, and we need to make sure that we're taking inventory. I think it's interesting. A lot of people will say, "Oh, I'm a doctor, so I don't check my things." I like, why? "Oh, I don't feel anything, so I haven't gone to the doctors in 5 years." Why? We don't feel these things happening until it's at the last stage. Our body compensates until it can't compensate anymore. So please, everyone listening, know your numbers, monitor your trends, and ensure you're taking proactive action to really reduce your risk of cardiovascular disease and its complications.
I absolutely appreciate and confirm all of that you're saying. The early screenings, I come from a family that was very quiet about their medical health and or just completely ignored doctors to begin with. What for? Why do I need to go there? I don't feel anything. And slowly but surely, a few things got them in the end that could have been prevented. And I've been on my soapbox quite a lot for a lot of things like that. When I hear people say stuff like that, I'm like, no, it's still important that you should it's just data that you're collecting and you're able to recognize where things are potentially improving or going not so great so that you can kind of catch it before it gets even worse of allowing yourself to have that knowledge. Why wouldn't you want to know about that stuff? So thank you so much, Michelle. I appreciate that. My final two-part question that I ask every guest is what is on your plate today, Michelle? In other words, what is the thing that you're working on next once we disconnect from each other? And what is the next meal that you will be eating?
After this call, I have back-to-back client meetings, so that's what I'll be doing next. And then for dinner tonight, I'm actually doing a couple of recipe testing. So I'm making a taco, and I'm also making like a delicious chicken, cabbage, carrot stir fry. So we'll see which one my kids like best, and we'll take it from there.
The double options. That's so wonderful. Well, Michelle, it's been a pleasure getting to know you and spending time with you. I'm so grateful that we were able to cross paths and meet up like this. And thank you so much for such wonderful information, especially coming from a specialty dietitian. I think that's such a fantastic resource that we now have been able to share with anybody who is listening or watching this. So thank you very much. And I hope that we get to cross paths again in the future. Maybe we'll even see each other at one of these conferences in real life one time.
That'd be great. Thank you so much for having me.